Let's talk about NotePath, what it is and what it does. NotePath is the ChartWise technology that analyzes documents from a patient admission and extracts a wide variety of coded information. This is done using natural language processing and advanced artificial intelligence technologies and comes up with very valuable insights and workflows that help verify and review the findings. At the root of all of this are the findings that are on the chart. These are the most granular pieces of information that might be there. Now, many people are familiar with things like ICD-10 coding that ferrets out diagnoses and procedures. But ChartWise takes that much further and also uses other coding sets like RxNorm and SNOMED and LOINC and others to find information that's not covered by the standard diagnostic and procedural coding steps. Things that are very important about the patient presentation and the way that a clinical case might evolve, and very important for looking at predictive analytics and developing further mathematical and statistical models. These findings are very granular and they can be very difficult to work with. Easy for the statistician, but on the clinical level, we organize that into a higher level called a concept. That's just a collection of findings that pertains to a single medical concept that a clinician would understand. Now, this example is showing a concept called edema, which means accumulation of fluid in the body. There's no corresponding ICD-10 code for that. You can't even code for that. But the SNOMED code set, for example, has a lot of findings related to fluid that's built up in various parts of the body. There are many examples of things that are clinically relevant that clinicians want to follow or trace or do statistics on that are not covered by the standard ICD-10 codes, and so we use all of these ancillary codes. And the concepts is a beautiful way to organize them into something that's clinically meaningful for the people at the forefront of patient care. And we take it one step further and go to the highest level, which is the topics. And I think this will really become clear when we look at COVID-19 and how we've organized it. This particular slide just gives an example of congestive heart failure, which includes not only the diagnostic terms in ICD-10, but a lot more than this. Chest x-rays, blood markers, diuretics, which are medications that would be used in heart failure, clinical presentations, all the ancillary findings. In fact, this is just a tiny subset of the evidence that will be found on the chart related to congestive heart failure. So with that knowledge of how we go from low-level findings to clinical concepts, here's our model as of today, and this is changing on an almost a daily basis related to COVID-19. So there are about, I think, 27 concepts that are on this slide. As I said, these are changing daily. Let's just take a look at a couple of the things that are here. Many of them are signs and symptoms that we all know are common for the patients as they present. Some of them are the ICD-10 codes that would go along with that. But then every time there's a new result or analysis that comes out, it's very quick and easy for us to add that. For example, abnormal sense of taste or smell. It turns out COVID-19 patients have a higher than expected evidence of blood clotting and deep venous thrombosis. There's been some evidence that certain H2 blockers may be beneficial. Also, interleukin-6 antagonists and other things like that that are being found on a daily basis, and within hours of that, that's in the model and ready for inclusion clinically. Well, let's see how NotePath puts all that together. All of the clinical notes from a patient encounter and admission are analyzed, and all of the interesting findings are identified. We call those findings in a note point. It is just what it sounds like. It's a point or a spot in the note that has that information. It's got text associated with it, and it's got a coded designation that goes with it. And what NotePath does, the name actually comes from the fact that it knows how to put all these together into a way to navigate through the chart. The electronic medical record can be so huge that it can be very difficult to ferret out the pieces of information that you're looking for, but NotePath does that in a manner that makes it very medical, very easy to read, and it creates a path of a topic, a concept, or a finding, and lets you navigate the chart that way. Well, let's find out how that actually comes to life when we look inside of a NotePath viewer at a theoretical patient who presented with COVID-19. Here we are inside the NotePath review station looking at that patient. I've started at the topic and chosen the COVID-19 topic. Notice there's 36 pieces of evidence in this particular excerpt from the chart that it is showing us on the right. You can see that these yellow highlighted areas represent things that were on that slide that had the concepts listed, and there's a whole variety of things presented in a very nice summary. We can dig in a little bit deeper and go down and see the various concepts that it knows to look for and that it's found. Here's one, for example, on oxygenation. Look at all the different kinds of representations of the oxygenation that have been gathered into one medically meaningful location. And if we want to see that in context a little bit more, we can actually navigate these one at a time. There's 9 findings related to oxygenation. Here's the first one, and the next, and the next, and we're in a spot where we can see all of this in context and know exactly what it was that was being discussed and review that. The other thing that NotePath knows how to do is give us a good summary of this concept by concept. Now we've gathered it all together in one evidence report. Each of these is a concept. Here's the evidence related to abnormal smell. Cardiac biomarkers. By the way, it's been found that people that have an elevated cardiac marker, troponin, when that's elevated, that tends to have a higher mortality associated with it. So it's one of the things that's important for us to gather as we take this information, find all the granular information inside of it, and get ready for the predictive analytics. And again, without going into each and every single one, you can see all of the references. This particular patient actually was on famotidine, which is the exact H2 blocker that has been found to be associated with a lower mortality. In fact, there is a clinical study currently underway to look at that. So these are all the concepts that it knows how to find specifically related to COVID-19. And as we said, very easy to expand this at any time new things are discovered to be looked at. We can add them specifically into the COVID-19 topic.
So as we move into the next part of the demo, we're going to discuss what we do with the findings and data that come out of NotePath as we move forward into analytics in machine learning. So as you can see at the top of the chart here, the clinical record, as well as other data sources, are fed into our NLP records analysis, which then pull out findings, which then can either get fed A, just straight to the database for analytics, or B, they can get pushed into machine learning models to where they're processed to create the predictive analytics. So in the end, you'll have point of care analytics, predictive analytics, as well as role-based dashboards. Also, this data can be pushed off to any other third-party solutions that you would wish for, like data collection, for example, CDC or WHO. The first dashboard that we're looking at here really shows a lot of the data that's gathered from health bots on the front end or from initial triage, where you're looking at reason for testing over time, as well as 14-day exposure, and where we're looking at, were you ill and that's why you came in, versus did you have contact with a confirmed case, or did you travel to an area where there are a lot of cases? The next chart, we kind of look at the number of comorbidities that a patient may have based on the number they have and how many cases came in that way. Then in the bottom left, we're looking at underlying conditions, like did they have liver disease or diabetes? Then we're looking at clinical course of the patients that came in, how many went to the ICU versus are put on ventilation or just were sent to isolation. And then on the far right bottom, we're looking at the health outcomes. how many people were sent home, how many are admitted to the hospital versus how many died. This one looks at the clinical findings. So these are the pieces of data we were looking at earlier in the demo with NotePath, and these are the individual findings kind of collected here by age group in the top left, then moving on to the clinical course, are they home, admitted, or died, versus age group, looking at ventilation versus isolation versus ICU. The bottom right is a collection of the conditions that the person had when they came in, broken out by age group. This screen is another view of those findings where you can see the count by age group that there were findings found for. Over on the right, we list out by age group the detailed numbers of how many of them went into isolation in that age group versus ICU versus ventilation, as well as the outcome. And in the bottom left, we're just doing another view of the clinical findings split out by the finding, be it fever, antibiotics, and so forth. Now, the nice thing, since we're utilizing the Power BI platform from Microsoft in the Azure Cloud platform, we can easily modify any of these dashboards to meet your needs. And what we're showing here is just several examples of using the different types of data we have. This dashboard's kind of a detailed view where you can split it out by hospital and location, and that location could be a unit or a floor. And what you're looking at are the patients that came through that location. And on the left side, you'd have your patient identifier, followed by the account of underlying conditions they had. Then you have a list, a comma delimited list of the underlying conditions, followed by how many findings there were and what those findings are, just to kind of help you pinpoint your most at-risk patients. This one's just another view of the findings where you can see the clinical course and the underlying conditions. And at the bottom, you kind of see a chart where you can see marked off which findings there were, and you can kind of compare those or sort by those here. And this one is also split out by hospital and location. This is an example of predictive analytics. So this data is all being fed by the results of the machine learning. So in the first chart, we're predicting how many positives versus negatives we're going to have day to day. Then we're looking at inpatient admissions. How many do we predict we're going to have day to day in the future? The purple line you see across there is the inpatient beds available. So we're really kind of looking at where do we need to be worried about not having enough beds for the admissions that are coming in. And the top right is the same thing as the admissions, except for we're only looking at ICU and ICU beds. The bottom left is a representation of the different health outcomes and clinical courses. And the size of the box is based on how many there are. And you can click into one of these and get into more detail. The bottom right is looking at what we predict the recovery rate's going to be. This right here is a view that if you click down to an individual patient, and you can see what their admit day was, what age group they're in, their gender, what were their comorbidities, as well as the findings found for that individual patient.